Hi, I am Dr. P Sharat Kumar, one of the orthopedic consultant here. Today I have a lovely couple. This is Prem Raj and his better half, Saujanya. So basically they had both had COVID almost 1.5 to 2 years back, and Prem Raj was admitted in the hospital. He was given a lot of medication, including steroids, and whereas Saujanya, she was not admitted, but she was given medication including steroids. So after the acute COVID infection, she was all right. For after 9 months, she developed pain in her hips. Both the hips she had pain. Whereas in case of Prem, he had problems in all over the body, more or less, right from COVID. So I have seen Saujanya after 9 months. After COVID, she developed pain in both the hips. For almost 3 months, she had pain. And when I saw her investigated, we did X-ray, MRI, and it showed avascular necrosis of both the hips. On one side, there was collapse. We did a replacement, right? On the right, it was collapse, whereas on the other side, it was grade 3. So she underwent right total hip replacement. We have done ceramic. It's uncemented on one side. On the other side, because the joint was preserved, we did decompression, what we call bone core decompression, and BMAC procedure. After that, she has recovered well. So whereas in Prem's case, he had problems in both the legs, both thigh, both hips for a very long time. For almost 1.5 years, he was suffering, and he was seen by many other colleagues, and we thought it's a post-COVID myalgia, arthralgia, like that. So when I saw him, we did X-ray and we have done MRI, and it showed extensive bone infarcts. In fact, both the tibia, both femurs, and both hips were affected. So because he was in a lot of pain, he could not sleep. Then we could not leave it like that. So I have done core decompression. I have done reaming of tibia, both femur, and both hips. And we also took bone marrow aspirate from the iliac. BMAC procedure also done. So in all, he had 8 procedures. Knowing that people can have complications if he had done everything on one day, because one can have fat embolism or pulmonary embolism. I have done first on one side, and after 3 days we have done the other side. So after the operation, he has done quite well. He is now almost asymptomatic. In fact, both are doing very well. You have Prem, anything you want to add, or your problems initially and how you are now?
Yes, after getting recovered from COVID, from the day 1 onwards, I could not able to bear my pain in my both knees, especially in the knees only. So even after the sleep, I could not able to walk even. So I can't able to stand even. So my legs are getting shivering. So that much of pain I was suffered with it. So after that, I was since we are from Vizag, so we inquired with a number of hospitals. We visited a number of hospitals. Everybody told that so they are focusing only on hip region. So since it is an avascular necrosis, so they are focusing on only hip. But in my case, I'm not feeling any pain in my hip region, but I could not able to bear pain at my knees. So one of my relatives told that referred Dr. Sharat Kumar, so that I came here. So you only given a hope for us. So why? Because there is an alternative procedure. No need to go for a replacement. Replacement is very tough task. So we no need to go for a replacement. So we have another procedure. So it created a hope for me. So after my treatment, so as you advised, so that exercise, regular activities, so as it is, I was followed. So I am completely all right now. So I can able to do my own things alone. So I could not able to seek. I don't want to seek any other helps also. So I can able to do my own things on my own. So I am very happy about it. So my only thing is, if so I didn't neglect the issues. So when I getting a pain, immediately I approach. That is the main reason. Initially it was addressed. Otherwise it may go wrong even. So that is, I am very thankful to you, sir.
Thank you. So, Gina, how are you feeling now? After,